My presentation is on muscle strains of the back. These are the learning objectives related to the cognitive domain. The cognitive domain is all about gaining knowledge. So we want our patient to describe how and when to correctly take each of her medications, especially the schedule for her steroid prednisone, which we're going to go over that in a later slide. We want her to state the major side effects to watch for each prescribed medication. She is going to be taking a opiate and a benzodiazepine, which can react together because they both depress your central nervous system. We also want her to summarize her understanding of the effects and risks of an opioid and define the actions of each medication so she knows why she's taking which one, especially since one of her medications are prescribed as needed. And then we are going to discuss non-invasive ways to alleviate back pain. So in this slide, we're going to go over the learning objectives related to the psychomotor domain. That is the action. And my particular patient learns best through doing. So this is where I would like to gear a lot of her teachings. The patient is going to demonstrate proper body mechanics of lifting, and then the patient's going to demonstrate proper posture when sitting and standing. Of course, what she can do with her current back pain. There are also other domains, the affective domain, which is the feeling. I didn't do any learning objectives for that, but if you want to reference that, it's on page 199 in our fundamentals textbook. So the first teaching strategy that I used was printed materials. So I'm going to have all the information printed and handy so that the client can look at what I'm talking about while I'm teaching her about it. This will aid in her retaining the information since she's a visual learner, and she also likes to have something else going on as the quiet makes her mind wander. It will also be a reminder for her to use as a reference should she need it when she leaves the appointment. She did state that having her kids in the background or music or noise helps her to learn. So hopefully if I'm engaging her brain by me speaking and she's reading as well, that engagement will keep her focused. For teaching strategy number 2, I chose demonstration. I'm going to demonstrate what I can during the appointment and have the client mimic what I do while I monitor her for correctness. Since the client is a visual and hands-on learner, she will be able to get involved so that she retains the information more. And I'm also able to see what extra practice she may need and in what areas she may need it in. And this is in regards to her posture while she's sitting to make sure that her spine stays aligned so that we can hopefully alleviate some of her back pain. This next slide is important. It's about how and when to take your medications. For a steroid, you're going to take those pills orally, and since this is a steroid, it has a schedule. We're going to follow it exactly. The side effects are listed on the next page, but for days 1 through 4, she's going to take 2 pills before breakfast, 1 pill after lunch, 1 pill after dinner, and 2 pills at bedtime, and so on and so forth, as you can see in the chart. One of the reasons we want to make sure that we take a steroid as it's prescribed is because our adrenal glands produce a steroid called cortisol. If we stop taking prednisone cold turkey or any other steroids, our body won't catch up with the production of cortisol that it needs. And it can cause depression, anxiety, it can cause vomiting, nausea, some really serious side effects. So we want to make sure that our body is producing the cortisol it needs, and we want to make sure we follow this schedule exactly. For tramadol, our opiate, we're going to take 2 tablets orally every 6 hours as needed for pain. With tramadol, since it is an opioid, there are risks that need to be discussed, which I will discuss in a later slide. And then we have methocarbamol, which we're going to take 2 tablets by mouth 4 times a day for muscle relaxation. With tramadol and methocarbamol, I had mentioned that there were reactions between those 2 drugs since they are both depressants of your central nervous system. So we'll go over that in a later slide as well. This is just telling her what she needs to take and when she needs to take it as prescribed by her doctor, making sure she understands. Okay, and on this slide, we're going to discuss the major side effects to watch for. For prednisone, our steroid, sodium retention, weight gain, high blood pressure, headaches, nausea, vomiting, those can all occur. So we want to make sure that we can kind of counteract those effects by making sure we get our daily 2 to 3 liters of fluid in. For tramadol, we can have nausea, vomiting, constipation. This is an opioid, so it does cause constipation, lightheadedness, dizziness, drowsiness, a headache. With methocarbamol, again, you have drowsiness, dizziness, lightheadedness, an upset stomach, vomiting, nausea, blurred vision. So we want to make sure not to operate any machinery, motor vehicles, while we're taking those 2 prescriptions, especially since they are prescribed to be taken together. Again, since both of those can cause constipation, you would want to contact your PCM and see about possibly getting a stool softener if that's something you're interested in, or if you have any issues with constipation. And also note that when you're taking tramadol and methocarbamol, you may feel extremely tired and have a sedated-like feeling. This can cause respiratory depression, coma, or even death. So if you have any issues, stop taking it immediately. Alcohol should be avoided while you're taking these medications because it can increase the risks. So no alcohol, no driving while you're on these medications. Make sure to stop taking immediately if you experience any of these side effects. And if constipation occurs and you can't alleviate that at home, contact your PCM and they'll see what they can do to help. And I had mentioned the risks of an opioid in previous slides. So opioids are known to cause addiction or dependency if you use it more than your provider prescribes. So make sure to follow your prescription just as your doctor ordered it. We want to avoid crushing, chewing, or dissolving the extended release form. It can be potentially fatal because it's a rapid release of the drug. And again, this depresses your central nervous system. You're going to keep it away from children. It's not recommended for children under 12, period. So you're going to keep it away from them, as ingestion could cause a fatal overdose for them. Again, it may cause drowsiness, mental fog, nausea, and constipation. So if you have or experience any of those symptoms, make sure to contact your PCM. And opioids can also slow your breathing or may cause difficulty breathing. So you're going to want to use caution. If you have any respiratory issues, make sure to notify your primary care. So this is the actions of each of the medications. Why are you given prednisone, tramadol, and methocarbamol for lower back pain? So the prednisone is your steroid. So how it's going to work is it's going to lower your immune-related symptoms such as inflammation and swelling. In this case, it lowers the inflammation and swelling to alleviate some of the pain in your lower back. You don't have that blood rushing to that area. And for the tramadol, this is used to relieve moderate to severe pain. It works in the brain to change how your body feels and responds to pain. Methocarbamol, this is used to treat muscle spasms or pain. It's going to relax your muscles by blocking the nerve impulses being sent to your brain. Okay, so this slide is where we're going to go over some ways to alleviate back pain that don't involve taking any medications. So the first way is our sleeping positions. We want to make sure that our shoulders and our hips are aligned while we're sleeping. There's some pictures at the bottom. This is just going to alleviate the pressure from the curving of your spine. Then you can use hot and cold therapy to relax your muscles and to take away some of the swelling. You can use hot water bags, which you need to be careful if you use hot water bags because you don't want the water leaking onto your skin and burning your skin. The same goes with an electric heating pad. You want to be careful so that you don't burn your skin because the temperature is too high. So try not to fall asleep if you've got an electric heating pad. Aquathermia pads, those are pads that are commonly used in healthcare facilities and at home. They help alleviate back pain and muscle spasms and mild inflammation. So these are safer to use than heating pads and hot water bags, but you still need to monitor them because it is a machine. Then you can use hot packs, which are a pack that you would strike against a surface or break it apart in your hand, and it's going to activate the heat inside. For a warm compress, this does have moisture and it's used to promote circulation, so it's going to draw heat to the area. That could cause some swelling and maybe irritation of the area a little bit more. So with the warm compresses, you may not want to use them unless you are feeling the need to just relax. Maybe a sitz bath or a warm soak may be more of what you're looking for. For those are just simply getting in a warm bath. For a sitz bath, you usually are sitting in warm water to the pelvic area. You can get it a little bit higher since it's your lumbar area, and you're going to fill the basin with water. They have basins that fit onto your toilet seat so that your buttocks fits into it, and the legs and feet can remain out of the water. A regular bath is not satisfactory for a sitz bath because the heat causes generalized vasodilation, which kind of alters the desired effect, which is kind of what I mentioned earlier with the warm compresses and some of the other warm methods. Now you can use ice bags or cold packs, and those will take away some of the swelling that is associated with irritation to the area. Just be sure, again, that if you're using an ice bag, you may want to cover it with a towel or something, and make sure that if you're using a bag, you're only filling it about 2/3 of the way full. Ice chips would be preferable to larger ice pieces. So if your refrigerator has a crushed ice method, I would use that method. And again, just place the cover over the bag to help absorb some of the moisture. And you want to make sure that you only leave your ice on for about 30 minutes at a time and then remove it for about an hour before you reapply it. So that's just going to prevent excess exposure to cold. Okay, so for this slide, we're going to work on proper body mechanics of lifting. So in the first bullet, it says use your legs and arms to lift, not your back. So in the picture, that's exactly what she's doing. She's illustrating using her long and strong muscles of the arms and the legs to lift and not her back. We want to make sure that we are holding the objects so that that line of gravity falls within our base of support. If you go out of that base of support, it'll put extra strain on your back muscles, and that's what she's doing when she is leaning forward on the second part of the picture. We're also going to face the direction you're moving to avoid twisting of the torso. And we also want to work as closely as you can to the object. This makes sure that the body's center of gravity stays close. All right, and then we also want to slide it, roll it, or push it when we can. Again, this just helps you to not work against gravity. All right, you can also make sure when you're doing any of these, we want to make sure that you're gradually increasing the physical activity, and we want to make sure that you're listening to the cues of your body. If your body is telling you, hey, don't do it, don't do it. Wait until your muscle strain or sprain has healed before you resume normal activity. Whatever your doctor told you, that's what you want to do. So for this slide, we're going to go over the posture when we're sitting and when we're standing. We're going to want to use those internal girdle and muscles and elongate our midriff when you're reaching, bending, lifting, or pulling. As you can see in the top picture, how her abdominal muscles are pulled upward and in, and she is tucking her buttocks in and down. That helps to elongate your spine and make sure that you're using the muscles in your waist. Okay, then we also want to develop an erect posture for correct alignment. Slouching can put strain on your neck and your back muscles. And when you're sitting, you want to lean against the chair and use that chair for support, keeping your shoulders back but relaxed. You're going to balance the head over your shoulders, avoid leaning it forward, and you're also going to keep those stomach muscles contracted in when you're sitting. So this slide is pretty self-explanatory about what I learned. We did already go over a lot of the lifting procedures in our 100 class, but it was still a nice refresher. So much stuff has been thrown at us over the course of the semester, it's hard to retain it all. But once it was looked at again, it's all triggered. I did not know about the effects of stopping a steroid abruptly. I didn't know that it could cause depression, anxiety, mood swings, delirium, joint pain, fatigue, body aches. I did learn about all of that while I was researching. I also was not aware of what exactly a teaching plan was. So until one of our fellow classmates said, did you read chapter 9, I believe it is, in the fundamentals textbook? I was kind of lost. So now I actually toned down my presentation. It was quite wordy, which I tend to have a problem with for a lot of my presentations. And I know Professor Woodard said straight and factual and to the point. So it was hard for me because, like I said, I tend to be wordy. But I did cut back and tried to make sure that I'm addressing the main points. So it was nice practice. And here, these are just the references that I used. The spacing is a little off on some of them. I don't know if it was just the PowerPoint. I have fiddled with it and tried to make sure my indentations were correct and everything was double spaced. You may just have to highlight some of the links in order to get to them or get to where I was.